Anxiety is an intense, excessive, and persistent worry and fear about everyday situations. Anxiety is a normal and often healthy emotion, but when a person regularly feels disproportionate levels of anxiety, it can become a medical disorder. Mild anxiety can be vague and unsettling, while severe anxiety can interfere with everyday life. Anxiety disorders affect over 40 million people in the United States. It is the most common mental illness in the country. Surprisingly, 36.9% of people who have anxiety disorder actually receive treatment. Anxiety disorders are generally treated by psychotherapy, medication, or a combination of both. Psychotherapy, also known as talk therapy, is usually the first step taken when treating anxiety disorders. Cognitive behavioral therapy, more specifically, is the psychotherapy form that is normally chosen. It teaches people different ways of thinking, behaving, and reacting to anxiety-producing situations. What people may not realize is sometimes this therapy on its own is not enough, and anxiety medication at that point may become necessary. Taking medications for anxiety has been frowned upon by society for decades. People view it as being weak or not trying hard enough to find a natural solution to fix the problem. It should be seen as bravery that people are able to acknowledge and accept that they need problem and ask for help. The ones who can treat anxiety with natural remedies should consider themselves lucky. When you're overwhelmed by panic, paralyzed by fear, or exhausted from sleepless nights spent worrying, you'll do just about anything to find relief, and anxiety medication can be that answer. Taking anxiety medication does not change the person that was originally there. It helps them. It creates a buffer so their anxiety becomes manageable. Treating anxiety with medication is generally safe and very effective. Prescribed medications play a key role in co-occurring disorders. They can reduce symptoms and prevent relapses. The most common types of medications used to treat anxiety are benzodiazepines, beta blockers, and antidepressants. Certain drugs will work better for certain types of anxiety disorders, so it's important to work with a doctor to find which one is best. Robert Huggs explains that mental illness is a global issue. It affects every race, nationality, and class. The stigma that mental illness is not a real illness, or that it only affects the weak, or that it is shameful, is absurd. Society needs to overcome this ignorant stigma that people should feel ashamed for having anxiety or taking anxiety medication to help. Would they say the same thing about a diabetic that's prescribed insulin? Of course not. People with anxiety disorders may need medications, just like people with physical health conditions, like diabetes or heart disease. There has been plenty of research to point out the negative effects that anxiety medication can have on a person. These have been marketed and described in such a way that people are afraid to take medications. The reality is that every medication has side effects, even the most common medications like aspirin or birth controls. The concern should be towards people who are taking medication that's not needed, or the fact that some physicians prescribed not needed medication like candy. Anxiety should be seen for what it is, which is a true medical illness, and taking medication for anxiety should not be frowned upon. It should be acknowledged and accepted that people are trying to better themselves and live the best life they can. Anxiety disorders are real serious medical conditions, just as real and serious as physical health disorders. Left untreated, these disorders can diminish an individual's quality of life and dramatically reduce productivity.